Hi, I'm Dr. Randall Silver with Sleep Matters, and today I wanted to take just a couple of minutes and kind of go through what's happening to your anatomy when you have sleep apnea and what's going on. So you can see over here, I've got my sliced head, and just to orient you here, here's your chin, lips, and nose. As you already know, there's two ways for air to get down into the lungs: in through the nose and down through the airway, or in through the mouth over the giant tongue muscle, and again, down through the airway. When we sleep, all of the muscles in the body relax, and that includes all the muscles here in the airway, the muscles in the soft palate and uvula, and of course, the tongue. For people with sleep apnea, and I'm going to oversimplify here a little bit, but basically what happens is you take all of the soft tissues here and they can fall back into that airway space, creating that obstruction. When that happens and you're asleep, you don't know that that's happening, but luckily the brain is wired to detect dangerous situations like that when you're not breathing. So your airway's not obstructed, the brain does recognize that, and so it's going to start a whole sequence of events to wake you up. That includes speeding up your heart rate, constricting your blood vessels, dumping different hormones like cortisol into your system, and typically between 10 seconds, even up to a couple of minutes, those activities that your brain is doing to wake you up works. You wake up, not to where you're fully conscious and aware of it, but enough to pull you out of those deeper levels of sleep, interrupting those sleep cycles, but also allowing those muscles to become more rigid again and opening that airway back up. So, like I said, after 10 seconds to a couple of minutes, that works. That airway is opened back up. Those tissues are no longer obstructing the airway. You get to breathe again, and then typically you go just right back to sleep. This sequence of events can happen over and over again for people with sleep apnea. It can happen 5 times an hour, 10 times an hour. I've even seen cases where it's in the hundreds of times per hour. All of those apneic events that are happening hour after hour, night after night, they do add up to some severe medical consequences. So if you have sleep apnea or you're concerned that you might have sleep apnea, please reach out to us and let's see if we can get you the help and the sleep that you deserve. Okay, talk to you next time.